Doctor, one of the conditions that the FDA approves hyperbaric treatments for is diabetic wounds, for a common term, I guess. Why are diabetics susceptible to getting open wounds like this in the first place?
So when you look at the disease process with diabetes, the effects of uncontrolled elevated sugars will affect tissues and nerves, blood vessels in the body. So patients that have long-standing diabetes that's poorly controlled, as it affects the blood vessels and nerves of the foot, they can lose decreased sensation. So problems with walking, they can lose sensation to changes in temperatures, cold and hot. And if they develop a wound, because they can't sense it, they often will develop an ongoing wound that by the time they recognize it, it might be too far gone to prevent rather normal healing. And so that's the area where they're usually seeing their diabetic specialists, having to probably see a podiatrist or wound care specialist that's trying to treat it. But when there's further involvement, usually what's called Wagner grade 3, where now they've developed deep infection into the bone, that's where hyperbarics may come into play.
And diabetics are susceptible for that going way down the road to even amputation.
Correct.
Isn't that correct?
Yes. And so if we can intervene early with the effects that we've known with hyperbarics as far as the decreased inflammation, healing, the new blood vessel and new nerve growth that may occur with treatments, that if we can heal that wound so that the surgeons have either minimal excision or risk of the amount of tissue that they have to remove is less, and possibly prevent having to have amputation done.
So can you explain exactly what hyperbaric oxygen can do for conditions like that?
So with the elevated levels of oxygen under pressure, you're getting the stem cell growth to promote new blood vessels, new nerve growth, which in turn improves circulation, decreases swelling, decreases inflammation, allowing those tissues to heal.
What's the duration of treatment? I mean, I know it varies from person to person, but how long does it take for hyperbarics to work on a condition like that, just in general terms?
Typically, the approved protocol for treating diabetic foot ulcers is going to be 40 treatments.